Blood sugar can rise while the meal plan still looks clean. The trigger can be a medicine, not a dessert mistake, even when exercise and sleep look steady. A new prescription can raise your usual numbers over weeks, so breakfast gets blamed for the wrong reason. The safe answer is not panic or quitting pills. It is spotting the pattern before higher readings feel normal. Most people review breakfast first. Then they blame fruit, bread, stress, or late snacks. That can be reasonable, but it can miss the calendar. A medicine change can shift the whole day, even when the plate stays almost the same. Time is the first clue. One high reading after a birthday dinner means one thing. A slow rise across several weeks means something else. Some medicines weaken insulin or make the liver release extra sugar. That can push your blood sugar into a higher range before any meal changes. Insulin is the hormone that moves sugar from blood into cells. Some medicines make that hormone work less strongly. Others raise appetite, add weight, or tell the liver to release extra sugar. So a food problem can be a medicine pattern. One common place to see this pattern is corticosteroids, medicines that calm inflammation. Prednisone is a common example. They can make the liver release more glucose, raising blood sugar. They can also make muscles less responsive to insulin after meals. The highest reading may not come from the largest meal. A morning steroid dose can make lunch and dinner look worse. The food gets blamed, but the timing points somewhere else. The clue is the pattern across the day. Steroid shots belong in the same review. People may receive them for joints, back pain, or allergy flares. The shot may seem local, but the body can absorb enough medicine to move sugar. That effect may last days. After steroids, some medicines can change appetite and weight. Some antipsychotic medicines are used for bipolar disorder or schizophrenia. One option may cause little appetite change, while another may cause more hunger and weight gain. That difference can change blood sugar risk over time. A psychiatric medicine can be the right choice. Stable sleep, safer choices, and relapse prevention matter. The goal is not fear. The goal is choosing the lowest risk plan that protects sleep and judgment. Another trade-off can appear in blood pressure treatment. Water pills are medicines that help the body remove salt and water. Thiazide water pills, a common blood pressure group, can raise fasting sugar in certain patients, but they can still lower blood pressure and protect the heart. Beta blockers are heart medicines that slow certain stress signals. They can help chest pain, rhythm problems, blood pressure, or heart failure. In some people, they also make low sugar harder to notice. That matters most for insulin users. Some medicines that worsen blood sugar also prevent something worse. A steroid may protect breathing. A cholesterol medicine may protect the heart. A psychiatric medicine may prevent relapse. That treatment may raise sugar and still prevent a breathing crisis, heart attack, or relapse. So, the useful question is not which medicine is bad. The better question is which risk needs action first. Start with 4 clues: why the medicine is needed, how high the readings are, how long they last, and whether symptoms appear. This logic also applies to statins, cholesterol medicines that lower heart risk. They can raise blood sugar in some people, but the rise is often small. That change is not a reason to stop the medicine alone. It is a reason to track the numbers and adjust the plan. The same blood sugar number can mean different things. One person has a small number change and a heart protection benefit. Another has rising sugar, weight gain, thirst, fatigue, and strong family risk. The answer should match the person, not just the number. The trade-off applies to hormones too. Hormones are body signals that change metabolism, appetite, and fluid balance. The effect is often mild. It matters more when other risk factors are present. The stakes rise with essential long-term treatments. Some medicines for HIV, a virus that attacks the immune system, can raise blood sugar. Transplant medicines and some cancer treatments can also raise sugar. The blood sugar plan should manage the rise while the main treatment continues. The medicine list should include everyday products. Decongestants, cough syrups, sleep aids, and supplements can affect sleep, appetite, or the heart. Some liquid medicines contain sugar too. For a useful medicine review, bring a complete list, not just daily pills. Include inhalers, creams, injections, vitamins, sleep aids, and cold medicines. Patients often forget creams, shots, and steroid bursts. Your doctor cannot connect high readings to a medicine left off the list. Once the list is ready, start with a timeline, not a villain. Write down the start date, dose change, steroid burst, injection, or refill. Place fasting readings, after meal readings, weight, sleep, and symptoms beside it. Dates help separate random readings from a real pattern. Fasting readings show the before breakfast number. After meal readings show how hard the body worked after food. Your A1C is the 3-month average, so it moves slowly. If a medicine changed last week, home readings may show the change first. Readings need context, so do not compare a sick week with a normal week. Fever, pain, poor sleep, and missed exercise can raise readings. A useful pattern compares similar days, then asks what changed. That keeps the review fair. Use warning signs instead of guesses. High readings for several days after a new medicine should prompt a call to the prescribing clinician. Thirst, frequent urination, blurry vision, sudden fatigue, or unexplained weight change should prompt same-day medical advice. If patterns or warning signs appear, management may include closer checks, temporary glucose treatment, or a different dose schedule. Sometimes the medicine still needs to continue. That is common with steroids, cancer care, transplant care, and mental health treatment. Do not stop heart, lung, psychiatric, steroid, or transplant drugs because the pattern looks convincing. Call before changing them. The safer decision must protect the heart, lungs, mental health, or transplanted organ while addressing the sugar rise. Dose changes how closely sugar needs to be watched. Higher doses often need closer checks than small doses. Taking a medicine for weeks matters more than taking it once. A short steroid burst can uncover risk that was already close. After dose, timing, symptoms, and the reason for treatment are reviewed, the choice may be a change, continuation, or longer monitoring. When the pattern remains unclear, a short monitoring period can prevent an unnecessary switch. One unusual number should not decide the plan. When breakfast, exercise, sleep, and stress stay similar, rising readings point back to the medicine list. That review can prevent months spent blaming the wrong meal. With diabetes, that pattern may require temporary dose changes during steroid bursts. Without diabetes, the plan may be fasting checks or an A1C later. Either way, the response should match the timeline and the risk. If insulin is part of that plan, one extra safety step matters. A medicine can raise high readings, but dose changes can also create lows. The plan should list check times, when to call for help, and specific numbers that need urgent action. Medicines can raise blood sugar through patterns, not moral failure. The pattern is the clue. Do not ignore it, and do not panic over it. Review the dates, protect the treatment you still need, and make the next decision with your clinician. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.